Hi, good morning. I'm still thinking about the dreams of addiction and codependence. I'm thinking about those because so many people are caught in them, and so much of the way that we think about those dreams actually make it worse, make the dream deepen, catch us at the deep levels of our body, our brain, our cells. And if we understand that, sometimes the mechanics can really help. Sometimes I think about myself as a mechanic, really, or somebody who just is like fascinated about how things are put together. I'm sure I drive people crazy that way sometimes. But also, if you want to get loose from stuff, it is so important to know how they hook together. And dreams of addiction via chemicals or via emotions hook together in the cells. They hook together in the deepest part of emotional memory. When I talk about memory, I'm not always talking about the memory of events. Those are highly significant in people's lives because we all have stories, and the stories of our lives mean a lot. They tell us who we are and where we've been, and often they tell us where we want to go. But one of the difficulties is that memory really that affects the present is memory that is kind of invisible memory. Emotional memory is invisible. I sometimes think of it as an invisible transparency that is right behind the eyes and in front of the processing visual cortex, and that the mind sort of experiences what's out there in the room through a transparency of emotional memory that a person doesn't really know they're looking through. I think that post-traumatic stress works like this for folks, so that an ordinary event for someone with PTSD is not ordinary, and it's really hard to know why it isn't ordinary, and other people telling them it isn't ordinary doesn't really help. In fact, it makes it worse, because at some fundamental level, people have to deal with their experience, and it doesn't matter if other people or if they think they're wrong. If it's their experience, they have to figure out what to do with it. And emotional memory is like that, and codependence and addiction both run deeply, deeply in the body, and they hook people together because we're wired to connect. That's not my phrase, it's somebody else's, some other mechanic of the mind, I guess, that I read, and I like that because we really are wired to connect. Babies are wired to connect with each other. We're wired for words, and those connect with each other. We're wired for love and all the emotions, and we connect that way too. And codependence and addiction take all of those natural wires, and they run different kinds of information through it, and they distort one's perception, so that actually in either codependence or addiction, a person is often doing the thing that seems like it will help and actually is making the dream deeper. And so they sort of work in reverse, which is another reason why it doesn't help to to oversimplify them, because they're not simple. Sometimes I think about my field, which is psychology, and probably personal obsession to a good extent, and curiosity for sure, and then addiction medicine. And I'm thinking about how often addiction treatment is sort of relegated to some minor deal, like, oh yeah, well, they're going to treatment, or oh yeah, they're in rehab. Well, or, maybe the training for people who work in addiction is not considered as important as the training for people who sit across the room in therapy. And also this whole business that there's a difference between addiction and mental health is totally weird. I mean, are you kidding me? There's not a real difference between anything and anything. There's not even a real difference between the flu and how I feel emotionally. I mean, treating them makes a difference, but you cannot possibly treat addiction without engaging mental health and emotions and memory. You can't do it. And that's why a lot of it doesn't work, because there really is no issue as dual diagnosis. Are you kidding me? There are people who have more severe mental illnesses than others. There are people who have much deeper dreams of addiction than some people. But it's in that individual, in that person, it's all rolled together, you know? Understanding that at first sounds, wow, that makes it a lot more complicated. Well, it is a lot more complicated. But you know, I hope if I ever have to have brain surgery, God forbid, my brain surgeon understands how complicated the terrain is. Because if he doesn't, we're both in trouble. And underestimating the power of addiction and codependence, by the way, which is just as involuntary, compulsive, and gripping as addiction. Making that a simple thing is like doing brain surgery with a spoon. It just does not work. However, what I do want to say is the 12-step programs do work, because if those steps are empty, that is, if somebody else's memory, definitions of God or higher power, or what it means to be powerless, if you can kind of push those definitions away, which are usually just definitions of somebody else's experience and ego, well, if you can push those out of the way, those steps are big and empty, and they actually fit so much human experience. Because what is really true is that the first step is a big, empty step. It's a big, empty step that you can get on, that you can crawl on, really, because or you find yourself floundering on, and then it's solid beneath you, because it's the truth. It's the truth, because what you're up against is not a matter of what you'd like to be up against or what you'd like to do or what you can control, because it's woven into your veins and muscles. You know, sometimes when people understand that there is a big impact, say, between their immune system and their emotions, then the rational brain or the human ego leaps in and goes, oh, well, you know, I can just be positive and get rid of the flu. Well, sometimes you can, but you know what? I think that depends how deeply you understand that. And if you're doing any of this to, like, exert ego control over it, probably won't work. In fact, I can almost guarantee that. I used to work with women who were struggling with infertility. And well-meaning people, maybe well-meaning people are people who really don't like to feel bad, and if you feel bad, they want you to stop so they feel better. I guess that's codependence too, because we are all hooked together, and when another person feels bad, we feel bad too. And there are lots of reasons for that in the neurological system of human beings. Those little wonderful mirror neurons that take the inside world of emotions of other people and put them inside. Well, now that's interesting, isn't it? No wonder we want other people to feel better so we feel better. But you know, when the women I worked with infertility were struggling, they were struggling with things like the death of a child every single month. And people would say to them, just let go. That's really interesting. It's interesting for a couple of reasons. One, it's way easier to solve other people's problems than your own, which may be why I'm a therapist. I don't know. There may be a little tiny piece of that. It distracts me. But the other thing, you can't just let go of something that has a hold of you. And in a way, infertility was one of those other human experiences that is just so hard and so gripping, and that you can respond to, but that there are so many pieces of that over which you have no control. And what the women who started to feel guilty for being infertile, which is how just let go ends up sounding to a person who can't just let go, like, it's your fault, baby. Well, if those people bought that, then when their babies died, you know, which was what was happening to them, you know, they would go to the doctor and they would have a fertilized egg, and then that would be a baby for them. And then they'd lose that, or they'd have a miscarriage, and then they'd feel guilty about grieving. They'd think, oh, well, negative feelings are what's causing this, and I must be causing my infertility. You see, this happens all the time. And that's why a deeper understanding of what it really means to be powerless. Powerless doesn't mean you can't respond. It means you're caught in a net. It means that how you respond has to have something to do with knowing where you are. Because you're not causing anything by having a real emotion. Except grief allows you to respond appropriately to death or loss and grief. And the whole process of addiction and codependence is like that too. It's way different than blame and self-criticism. So the point of all of this is a deeper understanding of the dreams of addiction, codependence, helplessness can help you if you're sort of at the end of your rope and feel guilty about crawling on that first step. Sometimes people say, I have to work a first step. They say that a lot. Well, working a first step, I think, is when you've forgotten that the first step is just true. It's like standing out in the middle of the river and trying to stop the tide. Well, here we have current here and tide, so if you stand in the middle of the river, you're liable to get caught in both. Oh, well, the first step would be appropriate then, wouldn't it? Powerlessness. So when you work a first step, you have to do that because you've forgotten why you got there in the first place. And then when you remember the stuff you did that you did to have power over not to know you were powerless, well, when you get there again, then you realize that, whew, it's a relief. It may be bad news, but it's a relief because then you don't have to drown and you don't have to feel shameful for what has a hold of you. And you don't have to let go of what has hold of you. The only thing you really have to let go of is your illusions and the part of you that keeps making you try to stop the river. Easier said than done, especially when the river seems to be flowing inside of all your cells and through your head, which it does for people who are either addicted or codependent. Anyway, I don't know, but I find this really encouraging, and I hope you do too. Stop back. We'll do this again. Bye-bye.